Good afternoon, ladies and gentlemen. Our webinar is beginning. We want to thank you for participating in this webinar today. I'm Steve Love, President and CEO of the Dallas-Fort Worth Hospital Council, and today is going to be another educational webinar that's being hosted in coordination with Medely, a new associate member of the Hospital Council. Today's topic: why your workforce isn't working, closing the gaps between float pools, FTEs, and staffing within Texas. This is going to be an interesting topic because we know workforce staffing is always something that you work at every day in your hospitals. We have two national experts that are going to discuss some new technology that gives clinicians choices, and it also helps stabilize the facility, and it helps the workforce family operate in a different way. This new solution offers a way to facilitate and manage internal and flexible staffing, streamline scheduling, and ultimately have good control of your cost. Our speakers today are Justin Lewis, who's head of enterprise at Medely, and Brian Tran, vice president of product at Medely. We're looking forward to their presentation. As we always do before we begin, please note that we welcome your questions. And if you would please type them in the question or chat box, we'll try to answer them before the end of this webinar. So with that, ladies and gentlemen, it's my pleasure to turn this over to Justin Lewis.
Thank you, Steve. I appreciate the introduction there. Good afternoon, everyone. Chris, I did want to make one note. Brian just sent me a note and said that his computer restarted. Are you still able to see?
No worries at all.
No worries. Okay. Good morning, everyone. Sorry about that. It's a pleasure to be here with the DFW Hospital Council. Just being from the DFW area, I actually live out here in Colleyville, and went to TCU undergrad, so around the area. Just understanding that you could be joining us from a really large health system in Dallas or a specialized facility in Fort Worth. We all know that the Texas healthcare landscape is facing a unique set of pressures today. We're not talking about a shortage anymore in nursing. We're talking about a coordination crisis. When we think about this, what if the walls between your core FTEs, your internal float pools, and your external contingent labor simply disappeared, right? Imagine a waterfall system that automatically prioritizes your most cost-effective internal staff first, and then only when needed, instantly tapped into a marketplace of 500,000 pre-vetted professionals to protect your ratios. So the truth is, you don't have to accept the illusion of being fully staffed any longer while your premium labor continues to climb. You don't have to struggle with fragmented systems where your scheduling software doesn't talk to your credentialing database. The friction you feel isn't a fact of life anymore. It's a symptom of outdated technology. So in the session today, you'll learn how Medley's talent fusion and workforce orchestration platform acts as a central nervous system for your hospital's labor needs. We'll show you how we seamlessly blend your core FTEs, your internal float pools, along with the marketplace of the 500,000 professionals that I just mentioned. So in our session today, why your workforce isn't working is about closing the gaps between float pools, FTEs, your multiple labor layers, and to that end, your staffing, specifically within the Texas market here. So before we dive into the why behind today's labor challenges, we need to define the how. So when we talk about Medley, we're not talking about a digital staffing agency. We're talking about the emergence of workforce orchestration, a fundamental shift in how hospitals manage their greatest asset, their people. Workforce orchestration is the central nervous system of a facility's operations. It's the ability to centralize every layer of your staff, balancing costs, coverage, and utilization in real time. So currently, Medley powers this orchestration over 7,000 healthcare facilities. While the industry average for filling shifts is often measured in days or weeks, our orchestration engine brings that average time to fill those per diem shifts down to 9 minutes. So quick, rapid response there. But speed is only one side of the coin. The true power in orchestration is optimization, and that's what we'll focus on today. By creating a unified ecosystem where your internal staff is prioritized, your external marketplace is integrated, and we help facilities achieve 94% fill rates while simultaneously realizing an average of 30% savings compared to traditional unmanaged agency models. So we're not just giving you a platform to find more people. We're giving you a technology to manage the people you have more effectively. So this ability to orchestrate at scale is no longer a luxury. These days, it's become a survival requirement, especially when you consider the rapid physical expansion that we're seeing across the DFW Metroplex. A lot of you are leading and working at these health systems and hospitals in the marketplace today. So you see that UT Southwestern's opening up a pediatric campus, Medical City. It has some surgical expansion. Parkland Health is growing in clinics. And so as our infrastructure expands, we're adding hundreds of beds. And if we manage those growth with siloed reactive staffing, we face a coordinated crisis that threatens our ability to scale these services. So, but there's some irony in that. As we build these state-of-the-art facilities across the Metroplex, we're still managing the people inside of them with tools from the 20 years ago, maybe 30 years ago. It's not just a software gap. Also, it's actually a manual labor crisis for your leaders as well. So most systems are reactive by design, relying on a 45-day scheduling cycles that can't pivot when the census spikes. So gaps appear, agencies feel at a premium cost, and because your data is split across multiple vendors, you can't see the total cost until it's too late, right? So think about the life of a unit manager during a 45-day scheduling cycle. When a census spikes, hits, or call-offs occur, the manual machine starts to grind. And first, there's this communication carousel. Managers spend hours, mass text, phone calls, making frantic calls late in the night, early in the morning, and chasing down staff via WhatsApp, or personal emails just to see who might be available for you. This isn't just inefficient, it's a massive drain on clinical leadership's time. So then there's the actual credentialing bottleneck. Even if you find like a clinician that can fill the shift, verifying their papers often involves digging through physical folders or disconnected spreadsheets. And if they're from an agency, actually, you're waiting possibly on a credentialing back from that vendor in PDF form, email, whatever that might be. So, and a lot of times that doesn't show up until the shift starts. And finally, there's this data fragmentation because your core staff is your core staff's in one system, your float pools on a whiteboard, and your agencies are in 3 different portals. You have no single source of truth. You are essentially flying blind, unable to see your total labor spend until the invoices hit your desk weeks later. By the time you realize you've overspent when you're looking at your budget, right, you realize that,
Looks like Brian has come back on there.
Yeah, that's what I was just saying. It sounds like he's back on. Of the data within your systems, right? You've got your systems, you have your main scheduling system, you've got maybe different labor layers like your PRN pool and a spreadsheet or a whiteboard. And then you've got your external contingent help, in different portals possibly, and there's manual communication back and forth between there. So when we look at these manual friction points, the phone calls, the spreadsheets, the credentialing chase, we have to realize that, it's not just frustrating, right? It's incredibly expensive. So we often focus on the invoice cost of staffing, but today we need to look at the leadership costs as well. The numbers on this slide represent, next slide, Brian. The numbers on this slide represent the financial kind of gravity of the current situation and how a lot of hospitals and health systems are set up today. We know that every time an RN, we've seen these numbers in multiple different research articles, et cetera, that it costs a facility, $60,000 to replace an RN. So when we, in kind of comparing that, whenever you lose a nursing manager, leadership, that can sometimes double or triple. So looking at not just that cost, right, but also looking at across hospital and health systems across DFW, on average, that's about a $5.2 million annually loss due to turnover. But there's a secondary kind of soft hitting cost, and that's the manual lift that we were just discussing. So think about your nurse managers and your unit directors and what their day looks like. They're the most critical clinical leaders. They currently, a significant portion of their salary is being wasted on administrative firefighting. When a manager spends 4 hours a week manually reconciling agency time cards or playing phone tag, to fill a Saturday night shift, that's clinical leadership's time stolen from patient safety and staff development. In many systems, we see the 20% tax, right? So unit leaders are spending up to 20% of their work week just managing the logistics of labor. So kind of 3 bullet points that I want to talk through there are the reconciliation drain. So business offices are spending dozens of hours manually matching punch-in data to their vendors' invoices. There's compliant risk, the manual lift of tracking credentials across multiple agencies, where a single expired cert can lead to massive regulatory fines. And then the burnout cycle, right? The administrative burden is leading to drive many managers to turnover. So where your leaders are exhausted by manual grind, they leave, and then that can trickle down to your frontline staff. So when 96% of CFOs say labor costs are their biggest margin pressures, they aren't just talking about the nurse pay, right? They're talking about the massive overhead of manual systems that requires constant human intervention to keep from collapsing. If the manual lift is exhausting for your leaders and draining your margins, the natural question is then, why can't we just why can't we just use the people we already have? The answer is that your talent isn't currently locked in. Your talent is currently locked in a digital dark matter. We call this artificial shortage. Next slide, Brian. Yeah, there we go. So if you look at this mess and look at this slide, right, this is an absolute mess. And this is typically how a lot of hospitals and health systems are set up today, right? This is not a flow chart. This is every one of those arrows is your nursing leadership or your leadership making calls or making communication in order to connect all these siloed different points of systems within your health system. So right now, most health systems in DFW are actually operating 3 completely different businesses simultaneously. You have your core FTEs on one scheduling system. You have your internal float pools, perhaps in a different platform or an Excel spreadsheet. And then you have your contingent labor managed through various agency portals. Because these systems don't talk to each other, you have no shared view of your total available capacity. This creates an artificial shortage. That we call it here at Medely. It's a phenomenon where you have a nurse in your system who wants extra shifts, or because they're part of core staff in Unit A, they're invisible to the manager in Unit B, right? Who is currently panicking and calling the agency to get a shift filled. So you're paying a premium for outside help while your internal resources are sitting on the sidelines simply because the technology can't bridge that gap for you. So if we talk about the information lag, when a system is siloed, a manager doesn't know a shift is unfilled until it's a crisis, typically. And they don't know who's credentialed to float until they check 3 different databases. And by the time they get a clear view of what, the clearest view they can get of their staff, the shift has already started. So this lack of visibility forces you into a defensive posture. You lose flexibility, responsiveness, and responsiveness exactly when patient demand is the highest. So we're not just missing staff, we're missing the connection between them. The staff exists, your disconnected systems just, can't find them. They're invisible to those systems. So which brings us to the core of why we're here today. There's a better way to do it, right? So there's a better way to run your workforce. One where the workflow we just saw is replaced by a single automated orchestrated engine. We believe that by unifying your total talent into one platform, you can finally move from filling shifts to orchestrating care. So to show you how Medely addresses these challenges, I'm going to hand it over to our VP of Product, Brian Tran, and Brian's going to show you the engine that makes this Unity possible. Brian?
Thank you, Justin. And I didn't get to say this because I joined a little bit late from my computer, but I just wanted to say before I dive in that it's so great to be here. I'm so honored to be here and to share with all of you what Medely is up to. And so what Justin walked you through just now is the reality of what healthcare staffing looks like today in Texas, especially, and where that current system breaks. But I'd like you now to just take a step back and go back to the beginning of how Justin first talked about it, the what if. And imagine a future where the challenges that Justin just talked about didn't exist. Imagine a future where instead of labor sources being so disparate and the data and the tools being split across different systems, instead of that, imagine a future where all of that works together in harmony. And because of that, you're able to see with so much greater sense of clarity everything that's going on. And hence the decisions that you're making are proactive, they're data-driven, they're done immediately in real time. And of course, what that leads to is just overall greater quality of care for the patients, the people that we all care for, and a happy, engaged workforce as well, the other side of the people that we care for. And all of that at a lower cost. And so that is the future that we're trying to build at Medly and through what we call our Talent Fusion platform. And so we believe, as Justin mentions, that the crux of creating that future that I just talked about is by unifying all your different labor sources, whether they be your internal staff or your external labor, all of that into one system. Then and only then can you have that single unified view, that clear view, and that is what unlocks and supercharges your ability to orchestrate a high quality, efficient clinical workforce. But how does that work? Like, why is that true? At its most basic, centralizing your entire workforce into that one system essentially means that you're able to unify the data that backs all of that workforce up. And right now, all of that data, as Justin mentioned, lives in so many different systems. And because it lives in so many different systems, whether they be your EHR, your HRIS, your payroll or time, or sometimes even your spreadsheets, you're missing, they don't work together. And so you're missing data when you're trying to connect it all together. And it's done very manually. And instead, you can have it all together. And that doesn't mean that you necessarily need to leave all the tools that you're currently using where all that data lives. The Medly Talent Fusion platform is able to integrate with your tools that exist today to create that unified data view. And it's through that full data picture, that's what unlocks the data clarity needed to enable things like intelligent data-backed decision-making across the entire workflow in real time. Whether that be from the very start, from forecasting to making staffing decisions on the fly, to real-time automated scheduling, and so on. But not only that, the other benefit of having your entire workforce all together is you're then much more able to implement and standardize the policies and the workflows and the rules that exist that you've got to manage your workforce. And that's across all of your labor sources, again, the ability to do that across all your labor sources at all your different locations. And it's that level of customization is then what then allows you to work and do that across all of your different specialized units. But let's dig a little bit deeper now into what that looks like. And so when I've gone out on the road and talked to healthcare leaders like all of you, one of the more common challenges that I've heard was that the workforce management tools that are being used today aren't built specifically for healthcare. And typically these workforce management tools are generic and they work for all industries. That's great for them, but as we all know, healthcare is a pretty specialized domain. And so to compensate for that, leaders like yourself are forced to acquire even more tools to help fill the gaps that these non-specialized workforce management tools are the gaps that exist there. And so not only are you having separate tools for different labor sources, you've got separate tools for different parts of your workflow. And so when we talk about managing your entire workforce all in one place, yes, it's about your entire workforce, all your different labor sources, but it's also for every step of your healthcare specific workflow. Whether that be from managing your credentials to unit-specific real-time automated scheduling to time and analytics, all of the above. And there's no need to jump to a different tool for every step of your process and have everything out of sync. Another common trend that we've been hearing, as Justin shared earlier, is the growth and expansion of many health systems. And that's really exciting. And that's exciting for all the leaders involved. But the actual execution of that expansion and rolling it out, we've heard can be a nightmare, as you might imagine. And one of the biggest challenges when it comes to rolling out, the many policies and the systems that you've got in place to these newer locations, is trying to roll out those different policies. And while we heard this with newer locations, taking a step back, we heard that with not just newer facilities, but it's standardizing it across all of the systems that these facilities have. And because the reality is that every facility is different in its own way, many of the solutions out there, again, because they're not healthcare specific, they actually don't even exist, this governance layer within these systems, or they're just too strict and it's too hard to customize for every unique facility. And so with the Talent Fusion platform, you can standardize healthcare specific policies, things like pay rates, like credentials, like compliance, approvals, depending on different scenarios and situations that you have. And not only can you do that at a central level, you can then enforce them with local flexibility whenever needed. And because, again, when all your staff is managed in a single platform, you can take it one step further and actually implement staffing rules, like prioritizing filling shifts with internal staff first. And only when there is a gap in your internal staff needs, whether someone called in sick or you've just got an unknown shortage, you can then shift immediately and intelligently to fill it up with an external labor source. That helps minimize overtime, control labor costs, and all of the above. So that saves you the headache of scheduling, right? Scheduling can be a huge pain, especially during a time of crisis. And that level of intelligence isn't applied only during scheduling. It can start at the beginning, during the time of what I mentioned earlier, even as early as planning and forecasting. And so forecasts within the Talent Fusion platform are done using latest census data along with industry trends. And it helps you show different scenarios of your forecast. It shows you different trade-offs as well across these different scenarios. And it suggests what an optimal mix of your internal staff and external labor might look like. Decisions there for you to actually ultimately make the decision. What else is there? But not only that, because it's there end to end from the beginning to that scheduling piece, you've got that whole picture. You can then be able to do and look at predictive burnout, and it helps then provide you suggestions as far as what to do when that burnout is predicted, whether it's to change the shift for that internal core staff member that you've got, or again, to fill it with external labor to ensure that your staff member isn't burning out. And lastly, an area that we haven't talked a lot about today, but it's still a really critical part of workforce management, is actually hiring your staff. And we all know the challenges that presents. Just the overhead of recruiting and finding time for interviews, and only to find that your pool of candidates that you've got are lacking the experience that you need. And even if you find someone who is experienced, reaching the level of experience that you need, you don't know if they're going to fit just your team and your culture. And but because Medly has its own network of pre-vetted professionals, the vast majority of the users of our platform actually are able to build their own pool of favorite professionals within the Medly ecosystem. And as they're building out that pool, some of them, because they've loved the experience of working with their favorite professionals, end up actually joining the health system full time. And so what better way to vet a candidate than to have actually worked with them many times before and enjoyed that experience? And so all in all, the workforce challenges that we've talked about today, they aren't temporary. They're inherently structural problems, and they do require a new approach. But the good news is that it is solvable. And it starts, as we've mentioned, by unifying internal teams and external labor into one system. And by doing that, that unlocks and optimizes the capacity that already exists. So my parting ask for all of you is to take a step back and look at the challenges that your team might be facing, and think about what inherently needs to change there. At Medly, we envision a future where healthcare staffing is transformed from a state of just constant crisis management into a more streamlined, proactive system where leaders like yourself can focus on the people rather than the operational fires that exist on a day-to-day basis. And so because of that, we believe it can be done. And that's why we're here. That's why we're a part of this council, and why we're honored to be here. And just to continue to hear your stories and hear your challenges and build that future that we all hope aspire to be.
Thanks, Brian.
So Justin, before we go to Q&A, do you have some other things you're going to add to the presentation?
Oh, no, I'll just say thanks, Brian, for going through that and kind of how we solved that. I think kind of we've covered what we wanted to cover today, but just to kind of reiterate what Brian mentioned, a lot of the health systems that we talked today and the conversations that we're in, the systems that are really thinking about this in the right direction understand that the tools that they have today aren't solving the problem, right? There's a gap between the fragmented siloed systems that they have today. There are multiple labor layers, and how do you build an architecture workforce strategy that actually helps you be successful there? So to Brian's point, I just piggyback off of, hey, we'd love as a call to action to spend some time with us and just share with us on what the challenges you're facing. And we can give some feedback on what we're hearing from other health systems and hospitals across the country and what they're doing to tackle these very challenges. But we definitely believe that Medly has the platform that really solves the core issue, which is visibility into your labor layers and optimizing that architecture and building that out for you. So that's all I would add there, Steve, but we're open to questions as well.
Yeah, and want to remind people, if you have questions, please put them in the chat box or the question box. I did have some people email me some questions, Brian and Justin, and thank you for an excellent presentation. You know, especially our rural hospitals and smaller community hospitals, all hospitals, because of the One Big Beautiful Bill and reimbursement changes and Medicaid, feeling financial pressures. But one of the questions I got, if you're a smaller community hospital without a dedicated workforce analytics team, is this solution really realistic, or is it really only built for large health systems?
Yeah, I can take that one, Steve. It's built for all facilities of all types, and that's proven just by the different types of customers that are using Medly today. One of the things when it came to building out our platform that we wanted to really ensure, as far as the way that we built it, was that it needed to be flexible. One of the biggest challenges is that we heard from our customers and prospects is just the challenge of change. Change in healthcare is hard, and so how do we make our platform as flexible as possible so that depending on whatever needs that you have, we can fill whatever gaps those are. And so you don't need to use the entire Medly platform if that's not the case, right? So we meet with and we talk with a lot of our customers that are, you know, those smaller facilities. To what you mentioned, they don't have a team, and they use Medly as almost a replacement of that team. And so and it helps whatever team they do have be much more efficient. So an example of that is a lot of these smaller facilities, for example, still do scheduling using spreadsheets. And while they know that that's not the most efficient, it's what they've got. And many times they just don't have the time to go explore like the multitude of solutions that exist out there. And so for them, they can use Medly just for the scheduling piece. Or we've got facilities who got their scheduling tool but don't have credential management. And so they can enable that part of the platform to do that piece. And so it is a bit of an a la carte-ness, if you will, with the platform that helps be the right solution for any shape or size of facility that you are.
Thank you. Good answer. And I'm glad it has that kind of flexibility. Another question I was sent, and I know how busy the people in our hospitals are, but they said we've tried building forecasting models internally, and by the time we get them done, they're out of date. At what point does it make sense to just not do that in-house? Do y'all have thoughts on that?
Brian, did you want to tackle that one?
Yeah, I can take that one as well. That's definitely something that we've heard, right? And I think so the question then becomes, why do forecasts become out of date? And a lot of times they become out of date because of the amount of time it takes to forecast through traditional methods. It's from what we've heard, like this back and forth between, you know, finance teams and the actual clinical leaders who are, you know, boots on the ground and trying to make the workforce management world work. And getting that sense of alignment, gathering the data needed to do proper forecasting, gathering, to what Justin mentioned, gathering all the different data sources from different silos. That's what causes the amount of time to take to forecast and hence becomes out of date. And so that's why, again, the unification of that data is so important, so that it's not this process of going to different vendors and asking for data and exporting it and merging it. It's all in one system. But even then, right, we know the world of healthcare where things change every single day. And so a forecast is never going to be perfect. And that's why we built that part of the platform where, sure, you've got your forecast and your plan, but it's going to change the day of. How does Medley then use the data that day of to help facility managers make the right decisions when it comes to scheduling that specific day? And so it's this acceptance, if you will, of, day of, it's not going to be perfect. How do we be as quick and as real time as possible to adjust?
Right. I've worked in hospitals for 35 years before I came to the hospital council, and this question was sent to me also. And, what is your secret sauce or recommendations where you help get the buy-in of, unit managers, charge nurses? They're used to doing things in a routine. They've done it for many years. How do you get them to change their daily workflow?
Yeah, I can grab that one, Brian. Thanks for that question, Steve. Yeah, I mean, obviously knowing that you've been in the hospital and healthcare market for a long time, you see this all the time, right? So there's a little bit of pushback against change, right? But I think the way we frame this is not just another tool for them to learn and utilize, right? So I think framing this with your administrative staff as this is relief for them. This will free up their time, and it's a tool to help them be more efficient. So we tell charge nurses, this is not more work. It's about ending that 6 a.m. phone call when you're trying to find extended staff, right? Going down that phone tree, sending text messages. So when they see, how the platform actually handles that communication carousel, then, they definitely see the benefit to the solution, right? So because you're giving back their time, to focus on patient care and clinical leadership. And then again, this is not a system, that's not a new tool that's going to change, the entire workflow. This is a solution that sits on top of what they're doing today, and it's a value add to their workflow to really have a kind of a command center to kind of orchestrate their flow from there. So there's a huge benefit, adds flexibility, adds time back to those nursing managers. And then from there, we have a full implementation team that helps with implementation, change management. We have a team that trains folks on the platform, and then you have a customer success manager that's dedicated to you, your hospital, and your facility to help support you in any time while utilizing the platform day to day.
Yeah, and another question. And I certainly understand this. Based on y'all's experience, Brian and Justin, and you look at other health systems, how do they handle demand forecasting if their census shifts dramatically week to week, especially in high acuity units? What are your thoughts on that?
Brian, did you have some thoughts there? And I could add some.
Yeah, I think that's, a follow-on to what I mentioned before about forecasting and just the challenge of that. I think in addition to what I mentioned before, as far as forecasting is hard because of the data challenge, and to what you just mentioned, Steve, like things change. It's again the acknowledgement that things change, and then how do you it's that, and then it's also the acceptance of how forecasts and things change is why many times when facilities talk about we want to bring we want a staff purely internal, and that's where that changes, and that's why that's hard, is because forecasts just ultimately change. And so the reality is that you do need that mix of internal as best as you can, but when that forecast does change, you can immediately reach out to a trusted and vetted professional, like literally within an hour. And so it's how do we be nimble, essentially, right? Within a world that just requires that level of nimbleness.
Yeah.
Right.
Yeah, and I would just add to that, Steve and Brian, that talk about that last kind of component you just talked about, Brian, is the ability to be nimble, right? So we all know this, that a lot of hospitals and health systems, their scheduling system's static today. You build that out for 45 days out, And then whenever something happens, right, the census spikes, what do you do from there? That's when that manual lift starts, that grind starts, where you have that carousel of phone calls and text messages, et cetera. So with our system, you're able to absorb that flexibility, that census flex with your system, with the platform, through that waterfall that we talked about when I opened up the conversation, the cascading of going from your internal labor sources, who's available today, who's credentialed to work these shifts that are, we had a spike in our ICU or ER, who's able to pick up those shifts there. The system will cascade out to those folks that are credentialed for those units, serve them up to your staff so that they can place those folks in that shift. And then as the census goes back down, you're able to flex in the system back down to the correct staffing needs within each unit. So it's moving away from a static system to utilizing the platform to build out that waterfall across your labor layers to absorb that spike that happens from time to time.
In y'all's presentation, and you did a good job, Justin and Brian, talking about this, but a question I have, if staffing data is in different locations or different systems, let's say four different places you have to pull the staffing data. How have organizations gotten a unified view of that labor spend without having to do a complete IT overhaul or spend a lot of IT dollars to bring and unify that data? How does Medley help in that?
Yeah, I mean, I could start off here, Brian, and you probably have a couple of points that you could add, but that's a great question, Steve. So the lift with our products isn't that heavy of a lift, right? So it's not like an EHR implementation or a full, UKG implementation or something like that. Just some examples there. So most organizations that we work with avoid that years long kind of overhaul because they're using our platform as an orchestration layer on top of their current solutions on top of their current systems. So instead of trying to force a massive data migration, you use a platform that integrates to those other siloed. So if you've got 4 different systems, we'll make an integration to those different platforms, pull it into one unified view into our system. So that gives you a single pane of glass view into your labor spend, weeks, not years. So we can implement, the system so that you have access to that information weeks, not years, allowing you to make decisions on real-time data rather than like historical reports. So it's not a huge lift for a hospital health system since we are layering on top of your current solutions today. But Brian's more of the IT product guy, so he may give a better answer there.
No, you actually nailed it, Justin. So good answer.
I'm looking, I don't have any other questions pending in the Q&A or in the chat box. I think y'all did an excellent presentation, and that's probably why there are not a whole lot of additional questions. But on behalf of the Dallas-Fort Worth Hospital Council and all the people participating on this webinar, Justin and Brian, we want to thank you. And I don't know if y'all want to have a final word before we close down the webinar.
I could close this up, Brian. I didn't know if you wanted to say a couple things.
I think just reiterating what I mentioned before, like just an honor to be part of the council. And as a product person, one of the most fundamental values that we have here at Medley is how do we build product that that resonates with our users. And so we're extremely user focused, if you will. And so the most important thing for us is being able to reach out and hear your challenges and try to work together just to solve for you. And so this is a great opportunity to do that. So thank you.
Yep. I'll just kind of reiterate what Brian said. It's a pleasure to speak with everyone. Thank you, Steve, for having us, and Chris. It's great to speak to everyone in DFW. And then just to kind of piggyback on what Brian said, we're always kind of working with our customers and our clients to better understand how do we solve those challenges. So we take a solutions outcome first approach rather than building features and functions, but how do we actually build a product that solves the challenges that everyone faces today. So would love to chat with anyone that's interested, and we'd love to hear from you and better understand if we might be a good partner for you as well.
Thank you all so much. And another administrative thing, Chris, as you know, does a great job orchestrating these webinars. This is being recorded, and he is going to share it with all the people that registered, because sometimes things come up and you couldn't be on the live, but you can certainly listen to the recorded. And I think he's going to make the slides available also for the people that registered. So thank you all for joining us for this educational webinar. We thank Justin and Brian again, and we hope everyone has a safe afternoon. Thank you.